When a 38-year-old patient presents with daily blackouts and tremors, it raises serious concerns. These symptoms are more than just inconvenient. They can be signs of underlying neurological, metabolic, or even psychological conditions. In this blog, we'll explore potential outcomes of these symptoms and the diagnostic tests commonly ordered to identify the cause. First, what do we mean by blackouts and tremors? Blackouts are sudden losses of awareness or consciousness, ranging from brief moments to several minutes. They may or may not involve falls, confusion, or memory loss. Tremors are involuntary, rhythmic shaking movements. They can affect the hands, arms, head, vocal cords, or other parts of the body. Possible causes of blackouts and tremors. The potential causes are wide-ranging. Here are some of the most common neurological causes. Epilepsy or seizure disorders, where focal or generalized seizures can cause both loss of consciousness and tremor-like movements. Parkinson's disease, which is more common after 60, but early-onset Parkinson's can cause tremors and occasional freezing or blacking out. Multiple sclerosis, or MS, can cause tremors, dizziness, or blackout-like symptoms due to nervous system damage. Cardiovascular issues like arrhythmias or irregular heartbeat can cause fainting or blackouts from lack of blood flow to the brain. Orthostatic hypotension, which is a sudden drop in blood pressure when standing, may lead to blackouts. There are metabolic or systemic conditions, such as hypoglycemia or low blood sugar, which is common in diabetics or people with poor diet control, and can cause shakiness, confusion, and blackouts. Thyroid disorders can also play a role. An overactive thyroid or hyperthyroidism can lead to tremors, while an underactive thyroid or hypothyroidism can affect consciousness. Psychiatric or functional disorders like panic attacks or anxiety disorders can mimic tremors and temporary blackouts or dissociation. Non-epileptic seizures, also called PNEs, are psychogenic in nature. They can look like seizures but are not due to electrical brain activity. Lastly, substance use or medication side effects. Alcohol withdrawal, stimulants, or certain medications can trigger tremors or cause syncopal or fainting episodes. Diagnostic tests and evaluations are honestly a really important step in figuring out what's going on. So here's what a doctor might order or recommend. Neurological tests could include an EEG, which is an electroencephalogram. That measures the electrical activity in your brain to help detect seizures. Then there's an MRI or a CT scan of the brain, which looks for things like tumors, lesions, or any structural problems. A neurological exam is also common. It tests your reflexes, coordination, muscle strength, and balance. For cardiac testing, you might have an ECG or electrocardiogram, which looks at your heart rhythm.